All right, you will not likely find a more stark illustration of the state of public health in Donald Trump's America than the headlines out of Pennsylvania today, where 2 people have died of an entirely preventable disease that was eliminated in the United States 26 years ago. There have been 2,777 cases of measles in the United States this year. That's the highest case total in 35 years. 94% of those cases were categorized as unvaccinated or unknown by the CDC. Vaccination exemptions for kindergartners in which parents seek to excuse their child from vaccine mandates for medical reasons or religious beliefs rose this year to a national average of 4.2%. That's up from 3.6% last year. In 24 states, according to the CDC, the exemptions exceed 5%. Now, those numbers may not sound like much to you, but the desired vaccination rate, we all learned this during COVID, to develop herd immunity is around 95%, which means, as it relates to measles in little children, we have no wiggle room at all. Yet the Trump administration is pressing forward with its anti-vaccine agenda. 2 weeks ago, Trump pushed guidance for the measles, mumps, and rubella vaccines, usually administered as one MMR shot, be given as 3 individual shots instead. He said, contrary to all science and without offering any evidence, that the 3 vaccines could be, quote, quite lethal together. Quite lethal. It's not true. And doctors have been giving the 3 vaccines as one shot since 1971. But that bit of disinformation contributes to a national environment in which vaccine rates are dropping and measles cases are rising. Pennsylvania Governor Josh Shapiro was in Lancaster County, where these 2 deaths occurred, to discuss the low vaccination rates in the area.
Today, we see the consequences of a lack of immunization in the first measles-associated deaths that our Commonwealth has seen in 35 years. To put a finer point on this, if 95% is that community immunity rate that we want to hit and exceed, here in Lancaster County, just 87% of all incoming kindergartners are fully vaccinated.
But Josh Shapiro is not the first person of note to acknowledge Lancaster's lower vaccination rate. 5 years ago, the future Health and Human Services Secretary, Robert F. Kennedy Jr., visited the large Amish community in Lancaster. The Amish, like other tight-knit religious communities, tend to have lower vaccination rates due to extensive use of religious exemptions. And in Lancaster County, RFK Jr. celebrated that fact, falsely linking vaccinations to autism and pushing an equally dangerous and unscientific cure for the measles, which, as we know, can be deadly.
We actually came down to Lancaster, Pennsylvania, and we interviewed a doctor down here who ran a big clinic. And he said, yeah, I've never seen autism among the Amish. We don't have it at that point. He never had seen it. And the CDC was so angry at that. Those agencies are going to do everything in their power to make the Amish vaccinate. What is the cure for measles? Your measles is chicken soup and vitamin A.
Chicken soup and vitamin A. The fact that that man is now running the Department of Health and Human Services amid the biggest measles outbreak in 3.5 decades is not a coincidence. Joining me now is MS Now senior reporter Josh Eininger. Josh, interestingly enough, some Republican officials in Pennsylvania are disputing this account. The county commissioner from Lancaster, Josh Parsons, says the coroner's office indicates that it currently has 0 reported cases where measles is the immediate cause of death. They have 1 case where a person died with measles, but not from measles. Measles was definitely not the cause of death in that case. All those words that I emphasized were capitalized. What's going on?
Well, so, Ali, that actually, the health department has since come out and said that that person that he's talking about there is a baby who died with what they describe as a lacerated spleen that requires some degree of investigation to figure out why the baby actually contracted that. That is apparently a symptom, can be a symptom of measles. The baby also did have measles. But can we go back for a second to the numbers that you read out there that Shapiro said? 87% vaccine uptake among kindergartners. So we were talking about this earlier. A kindergartner is like 5 or 6 years old. 5 years ago happens to be when RFK visited and had his chicken soup speech. Also, 5 years ago was when COVID happened, and a lot of people were very nervous about vaccines. And 5 years ago is when these babies were born. 5 years ago, the kindergartners then in Lancaster County, their uptake was 93.7%. Okay. So it's dropped 6 percentage points because these particular kids born then were not vaccinated.
There was an event in Tampa today. Florida Senator Ashley Moody, RFK Jr. said, quote, "We're doing a better job than any country in the world in controlling the measles outbreak." I don't really understand that. First of all, we didn't have a measles outbreak in the United States. This was largely an eradicated disease.
Right. Well, it was,
people get measles.
Look, if you look at the World Health Organization website, there's been measles, right? Yes. To your point, it's just in the United States. There was this amazing public health victory, and they declared that it was eradicated. And then there were all these sort of questions around the edges about vaccinations and what's safe and what wasn't. And then, of course, the COVID furor. And so a lot of people decided that they were going to stop, ginned up by obviously what you mentioned in the top to this segment, that they were going to stop giving their kids the MMR vaccine. Another point about Lancaster County in particular, and you made the point, Ali, that there's a pretty big population of Amish, Pennsylvania Dutch, Mennonite, people who don't tend to go to doctors, at least some in that community. But I don't. No one is suggesting that suddenly a bunch of people in that community stopped vaccinating their kids. So that is a thing that has happened, and it's one of the reasons why even 93.7% was lower than public health experts want it to be.
Right.
But the experts are saying that there is a clear link between the rhetoric over the last 5 years and the lack of vaccinations since then.
Yeah, and unfortunately, as you and Brandy Zadrozny talk about, people are susceptible to bad health information. If the internet's a steaming pile of garbage, it's more about that, more than politics. Health is the stuff where people are susceptible to disinformation. So if you're not under the care of a physician, or you don't, you like natural remedies, and that's okay, you may be susceptible to chicken soup and vitamin A sounds good.
Right. Look, listen, I had two Jewish grandmothers who told me I had a lot of chicken soup growing up, but I also had my vaccines, right? And I think that's the thing that a lot of doctors say that you should do. You can't fault people, though, Ali. Listen, it was a scary time, right? When COVID came up and there's this rise of misinformation and disinformation, and people aren't sure exactly what to believe. And so they're being told by people who say they're experts to question what the experts have told them for all this time.
And by the way, this whole idea of these kids, this child died with measles, not from measles. Right. It was the same language that we had during COVID.
Exactly.
When people died.
Exactly. And listen, anyone who's lost a loved one to a major illness knows that illness is rarely the actual cause of the disease. If somebody has cancer, their chemotherapy compromises their immune system, they then can catch something. That's what actually kills them.
Right.
So it's not. Yes, there's the literal definition of what is your cause of death. But would you have come upon that cause of death without the underlying condition? And that's what a lot of the reputable, the health experts are saying. That the reality is, in this case, the Secretary of Health is one of the people who, even today, was out there saying, we don't know. There's no measles in as a cause of death for these two people in Pennsylvania, so the state isn't cooperating with the federal government and giving us the information.
Can you believe we're having this conversation in 2026?